So do we have a problem? I think we have a problem. The American Academy of Sleep Medicine estimate that 26% of the adult population of North America have obstructive sleep apnea. There's a very well documented association with various comorbidities, and there is a strong co-mortality with obstructive sleep apnea. There is very poor reporting from physicians. The general population, the public's understanding of the problem is limited, but improving. The cost in terms of resources for obstructive sleep apnea, that is associated costs of the comorbidities and time lost, accidents, various other things, is tremendous. In the States it must run at hundreds of billions, and statistically 90% of those with obstructive sleep apnea have never been diagnosed. In fact, the majority of people are never actually screened, which is sad, really, because it would be such an easy way of the medical systems to save money, but they need to be proactive, and of course that's not historically that's not really a good enough reason. 22 million people, it's estimated, in North America, in the US, have obstructive sleep apnea. And one of the main problems is that we can't cope. There's just too many people. They're actually decreasing the number of sleep physicians coming through, and it's been estimated that with the current rate of testing, it would be 20 years. It would take 20 years to test the people who are suspected of having obstructive sleep apnea today. So that's not including the people tomorrow, the day after, and so on and so forth. 20 years. And that's just for the present. And the interesting thing is, in the UK, it's 10 times as long. It's over 200 years it would take at current rates. So I think it's fair to say that number one is we have a serious problem. Number two is that problem's not going to go away very quickly. There is still a need. And the issue here is that the treatments that we have, such as CPAP, continuous positive pressure, CPAP, continuous positive airway pressure, the mask hose and pump, that the compliance rates are not good. And so we have a vast problem with a limited amount of uptake for the treatment that's available, despite the fact that the consequences of not treating it are very significant in terms of time, money, and suffering and death. So what do we do? Well, this is where the dentists come in. We're talking about CPAP. CPAP is a $4 billion industry annually in the US alone, $4 billion. And it is not enough. It's inadequate. So there is an enormous, absolutely enormous marketplace for the dentist. And we're talking about obstructive sleep apnea. We're not talking about dental sleep medicine. So just the sleep disordered breathing aspect of dental sleep medicine is I'll tell you a story. When I first went into practice many years ago, it was the quote-unquote golden age of dentistry, in that we had the perfect storm, in a way. The need was there, the want was there, and the money, because things were much less expensive than they are now, was there. And that's what we have here with sleep disordered breathing and dental sleep medicine. We have a need that is so enormously vast that if only 1% of the people who need this treatment, this management, if only 1% of the people who have this turn up on our doors, the entire continent's dentists couldn't cope. We just wouldn't be able to cope. And I think it behooves us to be aware of these things now and think, maybe, just maybe, I can help. We desperately need dentists in this. We desperately need dental offices, their teams. We need to increase awareness, and we need to be able to treat these people. We need to be able to manage the disease. This is what we do. This is our area of expertise, or it can be. It's certainly the area in which we work every day. So here's a plea. We need more people doing this. We really do. And there is the need, and there is the business. Thank you.